All right. Thank you, fourth period, for once again hosting our recording of our lecture. Remember, you're going to be forever and ever on YouTube. Your comments. I'm recording right now. Hi. Okay. All right. Oh my gosh. Okay. So, I don't know. I might just erase this. Don't erase it? Okay. So, I want to review a little bit over body membranes because we talked about body membranes on Tuesday when the internet was down, and I did put that lecture. I'm going to put that lecture up as well. But I do want to talk about body membranes again. So, we have two general categories of body membranes: epithelial membranes and connective tissue membranes. Epithelial membranes are called epithelial membranes because they're composed of epithelial tissues. And so we don't want to forget our histology. I know it was way at the beginning of the year when we talked about tissues. But remember, we had 4 categories of tissues: epithelial, connective, nervous, and muscular. So we're going to discuss a little bit or remind ourselves a little bit of 2 of those tissue types through epithelial membranes and then connective tissue membranes. There were 3 types of epithelial tissue membranes. Can you remember what the 3 types were? Okay, no. The 3 types of epithelial membranes. Cutaneous, serous, and mucus. Okay, so cutaneous, I should do this in white. Okay, you guys, it's too loud, and all of your side talking really is getting picked up in the lecture. So, okay, so we have 3 types: cutaneous, serous, and mucus. And then of the connective tissue, we really just have one: synovial. Now, Tuesday, we spent most of our time talking about the serous membranes. We really didn't talk about the other 2. So we'll spend time today focusing on cutaneous and mucus a little bit more. But we will mention serous. And this will be up so that you absolutely can copy down this PowerPoint. Okay, this is the diagram that you did the DLCE of in your notebook on your left-hand page on page 43. Thank you. 43. And it shows mucous membranes, cutaneous membranes, serous membranes, and connective tissue membranes. Sorry. But it doesn't show all the mucous membranes. So we'll talk a little bit more about where all of those other. Then on the page that you did this, you would have also added the half sheet. Okay? And in case you forgot at home, DLCE means draw, label, color, and explain. Okay? So, epithelial membranes. Our first type, cutaneous membranes. This is the skin. Okay? The skin is the largest organ in our body. It's an epithelial membrane because it's made of epithelial tissues. And do you guys remember what kind of epithelial tissue the skin is made of? It's multiple layers of flattened, squished cells. So it's stratified squamous, yes. Okay. We have serous membranes, which is simple squamous epithelium with remember, we always have a connective tissue basement membrane. And then we have our mucous membranes. So types of serous membranes: parietal and visceral. Remember, what does visceral mean? Visceral means it's touching the organs. So your viscera are your guts. Okay? If you have a visceral response to something, that means that you feel it in your guts. Like when I talk about my ankle being dislocated and how it looks, there's a lot of people that kind of get this like, oh, I want to puke look on their face. They're having a visceral response. They're feeling it in their guts. Does that make sense? Okay, so visceral means that it's covering the organs. Your viscera are your guts. Louder, I can't hear you.
What is a shorter way to say about this serious?
A shorter way to say serous membranes.
She's like describing it like.
Serous.
Oh, how are you going to remember what a serous membrane is?
Yeah.
You know, I think maybe by process of elimination. Okay, if you can remember cutaneous, think of cuticle, like the skin around your fingernail. That's your cuticle. So your cuticle is the skin. Your cutaneous membrane is all your skin, okay? Mucous membranes, when we talk about them, it'll be really obvious what your mucous membranes are. So serous membranes, it's just it's not cutaneous, it's not mucus, it's everything in between. Okay? If you missed something, you can go back and you can see it tonight, okay? I know. Okay, so I used the example on Tuesday of the Mickey Mouse balloon, the balloon within the balloon. Here, they're using a balloon, but they're inserting their fist into the balloon. And so the fist here represents the organ. And the layer that is touching the organ is going to be your visceral layer. And the layer that goes on the outside of the cavity is your parietal layer. So remember, if you're talking about the lung cavities, it's pleura. So you have a visceral pleura and a parietal pleura. And if you're talking about your, I'll say your GI tract, your gastrointestinal tract, it's peritoneal. So you can have visceral pleura and parietal pleura. Visceral pleura touching the lungs. Parietal pleura is going around the lung cavity. You can have visceral peritoneum touching the intestines, or parietal peritoneum, which is lining the cavity. So the pleural space is the space in between those two membranes, where you have the serous fluid, which acts as the lubricant, so that when you take a breath in and your lungs expand, they have to be able to slide smoothly around inside of the chest cavity. And we discussed the diseases. I've already talked about all of this, okay? So pause it if you're starting to take notes and you're watching at home, pause it. But my other lecture goes over all of these, okay? But we talked about the diseases pleurisy and peritonitis, which are both inflammation caused by bacterial infections, or usually bacterial infection that causes inflammation in the spaces of those cavities. Peritonitis is deadly. If you have a ruptured appendix and it gets into the peritoneal space, you can go septic very quickly. Septic means you have that bacteria and the toxins that the bacteria produce spreading throughout your bloodstream all over your body. Okay. Now let's talk about mucous membranes. A mucous membrane is different from a serous membrane. Serous membranes create serous fluid. Mucous membranes secrete what? Mucus. And we have mucous membranes in areas where outside world meets inside world. Okay? Where we have a cutaneous membrane meeting up a mucous membrane. And so what's our vocabulary term for that? Oh, come on, you know it. Muco. Cutaneous junction. A junction is where two things meet. I know, I'm thinking conjunction, junction. What's that function? That's an old Schoolhouse Rocks video. Okay, so mucocutaneous is where the mucous membrane and the cutaneous membranes meet. You can feel one right now. Lick your lips. Now lick the inside of your lips. Now feel with your tongue the border between the rougher outside part of your lips and the slimier inside part. Okay? That's your mucocutaneous junction. So your lip feels slightly rougher than the inside of your cheeks, right? And if you licked like your hand, it would feel even rougher. That's because even though they're both stratified squamous epithelium, wait. It's all stratified squamous epithelium, but the stratified squamous epithelium on the outside of our skin and on our lips is keratinized, which means that the outer cell layers are hollowed out and full of a protein called keratin for waterproofing. The inside of our mouth, however, is not waterproofed. It doesn't have that keratin layer. So, saliva has mucus in it. Okay? Where is there another mucocutaneous junction? Our nostrils. I'm not asking you to lick your noses or anyone else's, please. Okay? So, in all of these places, you have outside world gaining access to the insides of our bodies. And there's all kinds of bacteria and pathogens in the outside world, aren't they? Yeah. And we need to protect. Okay? So our mucous membranes secrete mucus. So in our mouth, in our saliva, we have mucus. In our nose, we secrete mucus, and it gets all on the hairs inside of our nose. And air passes over those hairs, and it traps dust and debris and bacteria and viruses, and then it dries, and what do we call it? Boogers. Mocos. Now, when you're sick, what happens to the level of your mucus production? It intensifies, it increases, and so you get more mucus because your body's trying to flush out and get out whatever is in there. When you get a chest cold and you're coughing up stuff, your body is trapping all that bacteria in the mucus, and the mucous membranes are being irritated, and so you're secreting more and more mucus. Okay, question? What is a blood clot? In your lungs? It could kill you. But that's something, let's talk about blood clots when we get to the circulatory system. Okay, because blood clots aren't in your air passageways. They're in the blood vessels. Okay? Yeah, let me. Eye mucus? So that's just tears, the normal secretions in your eyes, which have dried up, and the salts are left behind, because water will evaporate, but the salts don't. So it's because your tears are salty. Yes, you know this, right? And so when you're sleeping, your eyes, you might even cry in your sleep. And okay, let's not get off track. So the purpose of the mucus coming from these membranes is a protective mechanism. But we don't just have mucus secretions or mucus membranes. We also have mucus membranes, not just in our nose and in our throats and not our esophagus. Well, your esophagus, no. I don't think really in your. Let me think. It's a stratified squamous. You probably do have some mucus membranes in there because you want to help food slide on down to your stomach. But definitely the vagina and the anus. Okay? Because both of those areas, you're exposing your insides to the outside world. And so you need to have protection, but also mucus to aid in having a bowel movement. Okay? All right. Mucous membranes will have cilia. Many of them, like your respiratory tract, will have cilia on the surface. And does anybody remember the name of these cells? It looks like it's multiple layers, but it's not. Pseudostratified ciliated columnar epithelium with goblet cells that secrete the mucus. This is what lines our respiratory tract. And this is why smoking causes, if it doesn't cause cancer, you get the complication of the smoker's cough, emphysema, chronic obstructive pulmonary disease, which is a whole host of wonderful diseases, because the nicotine puts the cilia to sleep. The cilia stop beating, and you stop getting the movement of this mucus up out of your lungs. And so the mucus continues to trap dirt and dust and pathogens and then all the tar and the stuff that you inhale with the cigarette smoke, but the cilia aren't carrying it up and out, and so guess what? It stays in your lungs. Makes me want to have a cigarette right now. How about you? You're like, okay, well, I vape. Well, when you vape, you still get the nicotine, and that means you still put those little cilia to sleep. Why, when you stop, do you often get a cold or you start coughing a lot? That's because those cilia will start to come back and start beating and moving that stuff on up and out. Question.
So you know those like patches that stop you from smoking cigarettes? Don't they also feed you nicotine?
Yes, it feeds you nicotine, but the idea with the patches is that nicotine is going to go to your brain, and it's going to feed the addiction in your brain. But what people don't realize is that nicotine, it works out of your system within about 2 days. And so the cravings that people feel for cigarettes is more of a behavioral than a brain craving. Smoking is one of the hardest addictions to get over. I strongly, strongly urge you never to even start. Ozzy Osbourne said he kicked every drug, but he just could never quit smoking. Cigarettes. Yes. Okay, I forgot to unpause the video. So here we have connective tissue joints. They're called connective tissue membranes because there's no epithelial tissues. So it's going to be all connective tissues in there, cartilages and like hyaline cartilage, and secretion of a fluid called synovial fluid. So we had, I think, bursal. Bursal is one of our vocab words, right? Yes. And bursal are going to be like these little pads, cushioning pads that you find in joint spaces that act like little squishy pillows to help reduce friction, but also compressional shock. One of those bursal is on the side of your knee, and it can become inflamed really easily if you have knee issues, and it can be really tender. You've heard of bursitis? Have you ever heard of bursitis before? Bursitis is inflammation of the bursal. So you can get a problem with your elbow from repeated motion if you're a tennis player, and you can get bursitis. Inflammation of a bursal. Okay, so these bursae, when they become inflamed, we call it bursitis. So they're little pads of synovial fluid that act as little shock absorbers or cushions in the synovial joints. So if you have chronic inflammation, chronic meaning constantly, all the time, the opposite of I know the other meaning of chronic. That's not what I'm talking about. I'm talking about chronic pain that's with you every day, day in, day out. Whereas I'm going to have a chronic issue with my ankle. I'm going to have an issue with my ankle for the rest of my life. Whereas if I had just sprained it, that would be an acute problem. So acute is opposite of chronic. Acute means sudden. When you have chronic inflammation in a joint, you can start to wear down the bursae, the synovial fluid, and the articular cartilage at the ends of the bones. And so that leads to arthritis, which is inflammation of the joint. And chronic arthritis is going to lead to the breakdown of the joint to the point where you can have bone grinding on top of bone. And so when you have arthritis, osteoarthritis to the point where you are bone on bone, that's when they're going to do a joint replacement. Before that, what are they going to do? They're going to give you injections of cortisone. Cortisone is a steroid, which is a very, very strong anti-inflammatory. So you treat the inflammation. Without the inflammation, you don't have as much pain. Okay. They can also inject materials into the joint space that are going to act like the synovial fluid to help increase the lubrication at the point of the bending. Long-term problems where the joint is completely broken down, what are they going to do? They're going to replace the joint. They're going to literally go in and they're going to cut off at the bone above and below the joint, and they're going to just take it out. And they're going to replace it with metal and plastic so that the joint is never going to wear out, right? They don't replace the whole bone. They just attach the new metal and plastic joint to the existing bone. And we'll look at joint replacement surgeries when we do the skeletal system, which is our next chapter. All right, switching gears. You will now go to page 46, which is our next right-hand page, and that's our notes on the skin. And we are going to add this acronym to help us learn the functions of the skin. So I want you to write this down. SHAPES is our acronym. An acronym is like a word, and each letter in the word is going to help us to remember something. Your chapter in your book does this kind of backwards to me, because I would like to start off with what's the function of this body system, but this chapter puts the function of the system at the end. So the first two functions of the skin are sensation and heat regulation. Okay, so sensation is, change out of black there, sensation. That means your sense of touch, right? We sense the outside world through our skin. Heat regulation through sweating and vasoconstriction. We help to either give off heat or conserve heat. Vasoconstriction, that's a big word. Vaso meaning blood vessels. And constriction, what does to constrict mean? To squeeze, like a boa constrictor. It doesn't have venom, it squeezes its prey. So vasoconstriction is that the diameter of the blood vessels in your skin decrease, and that's when you go pale. You decrease the blood flow to your skin. This also happens when you're really frightened. You've heard the saying, she was as white as a ghost. Okay? You were white with fright. That's because of vasoconstriction. All the blood goes out of your skin and you get paler. So yes, so when you press on your skin and you see the white spots form, that's vasoconstriction. You're manually doing it. Okay, the A is going to stand for, why am I drawing a blank now? The A is going to stand for, let me do the ones I remember, and then I'll get all of them. The P is protection and production. The E is for excretion. Gosh, I've been looking at this all day and now I'm going blank. The other S is for synthesis. And the A is for, I can't believe I'm forgetting it. Okay, it's on my next one. Okay, synthesis. What are we synthesizing? Vitamin D. I hope I didn't mess this up. Vitamin D we are synthesizing in our skin. We are excreting salts and water through our skin. And the next slide has a better description of all of these. So have you guys copied all this down?
Yeah.
Okay. Let's see how bad I messed this up. So P for protection. Oh, okay. Absorption. And I did mess up the last S. Okay, so here I'll add this. So sensory perception, that's our S.
Which S?
The first S. Sorry. This is the last S.
Storage.
Storage. Sorry, I said secretion, but it was supposed to be, this is the P and this is the P. Protection and production, okay?
Vitamin D for.
See, vitamin D for production and protection from the sun. The storage, the last S is for storage, like storing fat, water, vitamins, and salts. Wait, what? Look, SHAPES. The first S is for senses, right? The second, the H is for heat. What did it call it? Heat. Regulation, thank you. The A is for absorption. What are we absorbing? Certain substances can be absorbed through the skin, like medications, like the CBD that I rub on my ankle. The P, there's two things, production and protection. So protection and production. The E for excretion. And the last S for storage. Sorry, I messed that up. And this, you found some place to put it on your page 46. Tomorrow we're going to talk in more detail about the layers of the skin. I better study up tonight so that I brush up on it. I haven't looked at this stuff for a year. So I will study up tonight. Okay. Please make sure that you join, that you like my Facebook page. That you,
Facebook?
I mean, why am I saying Facebook? My YouTube page. Sorry. Facebook. I know I'm old. I use Facebook too. That you like and that you join. Subscribe. Subscribe to my YouTube page. My YouTube channel. It's a Facebook page, a YouTube channel. Oh my gosh. My gosh, all this stuff, you guys, I have forgotten more than you even know at this age. Yeah, I have a Twitter, but I just don't use Twitter and Instagram that much. Yeah, I have all that stuff. I've used Kick in the past. I know about Kick. But I just don't use that stuff. I just don't have time. All right, you guys. Bye.